Hi guys, my name is Dr. Paul Robinson. I'm a chiropractic specialist here at Paragon Chiropractic in Bloomfield Hills, Michigan. And today I want to talk a little bit more about what we're actually doing chiropractically, what we're looking for in our patients, and also what we're looking to avoid. So what we have here in front of us here are the 4 different stages of spinal health. This is what a healthy spine actually looks like, a healthy vertebra. So you have the disc right in here, you have the bones around it, and you have the nerve that comes out of the spine. So chiropractically, our biggest concern is not actually the joint pain that a lot of our patients experience, it's actually what comes out of the spine, your spinal nerves. These spinal nerves control every organ, every tissue, all the major functions of your body, and our goal is to make sure that these aren't being interfered with in any way, shape, or form. So most people start to have back pain usually in their early 20s, early 30s, and that's because these discs are about 80% water. So most people in their 20s, 30s, they're in college, they're starting their careers, they're not getting very much sleep, they're drinking alcohol, not drinking enough water. So throughout the day, as you walk around, you begin to squish and push a lot of the water out of the disc space. And it usually takes about 7 to 8 hours of sleep for your body to fully rehydrate this area. If you're not getting enough sleep, you're not drinking enough water, you're drinking too much alcohol, these discs will actually remain compressed, and that puts you at higher risk for injury. So if we look over here, this is actually the first sign here where we begin to lose some of that disc space. As we lose that disc space, that's where you're more likely to cause a misalignment in the spine and where you're actually more likely to actually injure or basically tear or herniate or bulge the disc. If left untreated and the lifestyle isn't corrected, that brings us to the next stage of degeneration. So this is actually what a disc bulge or herniation looks like. The disc pushes out away from the vertebra, compressing that nerve. As you lose that disc height, you have aberrant motion, inflammation. This causes the lipping, the spurring, the arthritis. And if you actually will compare the healthy nerve to the unhealthy vertebra in this area here, you can see with this nerve, you have lots of room around the nerve. The nerve looks really, really healthy. If we look in here, you can actually see where the vertebra is beginning to compress down on the nerve, or with the bulge or herniation, you can see how that's actually compressing the nerve. And notice the nerve looks smaller, it looks less healthy. This is what we want to avoid because these nerves are basically helping to control and regulate almost every major system and function of your body. If this continues to go untreated, this brings you to the final stage of degeneration, basically a complete loss of the disc space, lots of lipping, spurring, arthritis. You can see in here that it actually is bone on nerve in that joint, and the nerve looks very diseased and it's quite uncomfortable. So the goal is to basically avoid getting to this stage, see a chiropractor early on, because at this stage, you look like that guy who hasn't been to the dentist in 40 years. The teeth are all pitted, misaligned, they don't look good. Basically the same thing's going on for your spine. So it's just as important to take care of your spinal health as it is for your dental health as well. So hopefully that helps a little bit, kind of gives you an idea of the different stages of degeneration, what we're looking for, what optimum is, and why we're trying to keep you there. So please like, comment, and share. If you have any questions, please feel free to reach out to us. Have a great day and thanks for watching.